Hi, I'm Renee Knapp, and I'm going to be presenting today about the benefits and development of a community-based approach to mental health. I currently work as a deputy principal at a regional school in Western Australia, and I'm the chair of a community mental health action team. And I also have my own consultancy business called Think Effective Consultancy, in which I support people to implement mental health and behaviour strategies in schools. And also I look at helping and support people in implementing cross-sector approaches to mental health. So during our session today, I'm going to talk to you a little bit about my experiences and how I got started in having a community-based approach to mental health. I'm going to talk to you about some key benefits and why I think it is a really important and great way to go about improving mental health in communities. And then I'm going to talk to you about some key strategies that I think that you should put into place if adopting this type of approach, and just some tips that I have found that have been useful and have ensured as seamless a process as possible. So I thought I'd just start by talking to you a little bit about my experiences and how I got involved in this approach to mental health. So, as I mentioned, I work at a school, and about 5 years ago, we were looking at improving or changing our priorities. And we really wanted to look at the whole picture of a student and what was going on for the student that could impact their education. So, I was currently a chair for a behaviour team, but I really felt passionately about mental health and wellbeing and felt that this was an area we really needed to consider for our students. Now, at the time, I was invited to go along to a meeting that a group called GP Down South had organised. And during that time, I met with various other community members and we discussed mental health. And it became apparent to me that there was a few other people who shared my passion for mental health. And when I left the meeting, I went away and had a little bit of a think about it and thought, why not do this approach as a community rather than just as a school? Our staff were very stressed and couldn't really commit to creating another committee. But I thought, why not have the school as a key part, but be a part of a community approach to mental health and actually involve some of the different sectors and get us working together to see how we could improve things for students. Now, this was what I like to call a light bulb moment for me, because I suddenly got to think about what was going on. We as a school got to think about what was going on for the students beyond the school walls. And this was the first time that I'd ever really engaged with groups outside of education to consider this. We'd certainly had network meetings within education, but for the first time we were getting to talk to doctors and other medical professionals and law enforcement and business people about what was going on for our students. And this was really incredible because this is where we could actually affect change for our students in terms of their mental health. Because when we looked beyond the walls, we got to suddenly see that although we were working in the area of education, there was actually so much more going on for them. And we could start looking at their health and well-being and their physical health, that side of things. What was going on for a student with regards to law enforcement, and was there any engagement with our local police, with our students? The social connections that they had and the opportunities for social connections that existed within our community that could support our youth. A sense of belonging, and did they have an opportunity for that? Were they engaged with sports? Were there a variety of sports on offer for both our female and male students? Was the environment that the kids were engaged in and living in conducive to their mental health? Were their interests and needs being considered? And what sort of family scenarios were going on in our community? And were we fully aware of what was happening for our kids? Now, much as I came into that process thinking about it from a youth perspective and thinking about how fantastic this was for the youth, this led me to what I call my next light bulb moment, in that I started to realise the potential not just for the youth, but actually for the mental health of the whole town and all of the different ages that existed within our community. Because much as we could look at what was going on for the youth in these key areas that I've just talked about, we suddenly realised as a community team that we could actually start considering what was going on for all of our communities population with regards to health, law enforcement, social connection, sense of belonging, education, in terms of the mental health realm. What was going on? What was our local law enforcement doing to support the mental health of our community members? What was the education areas doing? Was there education for our people? Were the different areas working together? Were there social connections and a sense of belonging? So suddenly we were able to think about this and how it could help our entire town. And so that's really where my passion has come from, because I've seen this incredible benefit. And our team is growing constantly. We've actually just recently written a community wellbeing plan that we've engaged and worked with the West Australian Mental Health Commission on. And that has been really exciting, because we're getting to start looking at how we can affect change at a local government level and at a shire level, and not just being a group of people who are passionate, but actually being a group of people who can make real change happen in our community and surrounding areas. So I guess what I want to talk to you about now is, what are some of the key benefits from having this approach? Why do I feel so passionately about it? And why do I think that it's of great benefit to lots of communities? And when I say communities, not just rural communities, but also city areas. Obviously, it can look differently, but any community, wherever it might exist. So I think a really key benefit is that by having a community approach, it actually encourages consideration of all the areas that are essential to mental health improvement. It allows us to consider prevention, support pathways, all those types of things. It allows us to look at the educational side of things, the support and health side of things, and the things that exist in that area. The law enforcement, when things with regarding mental health don't necessarily perhaps go quite as well as individuals might have wanted to, but helping people get back on that path to a positive mental health and to a good place in society. And obviously looking at our community groups and how they can have a role to play. So it really allows us to consider all those areas and that key area of social connection and belonging that is critical and integral to all human beings. And I think that's been shown really clearly recently. I think that having a shared approach to problem solving and prevention is just key. I think that as different areas, and certainly I keep coming back to talking about health, law enforcement and education, but I really mean all of the areas that are involved. And I think when I say health, there's such a wealth of different areas when we look at our health services and our psychological areas and our hospitals and our aged care and all those different things. But I think by having a shared approach, what we start to realise is that we're often facing similar issues, and we can actually work together to solve some of these problems, which one ensures better, more effective outcomes for everybody, but also ensures that perhaps we lessen the load a little bit for each of us, allowing us to each do our job more effectively, but also allows us to have a sense of connection and belonging with each other, which is really, really fantastic and can be great, certainly in times of support that we might need. I think, as I mentioned, that opportunity to develop a connected community and sense of belonging is just critical. I think now more than ever with COVID, we've really seen that sense of belonging and connection is so important to us as humans, that we need that sense of connection. And although it looks very different for everybody in the way that they get it, it's a really important part to foster in communities. I think another great outcome that we've certainly discovered is the opportunity to create intergenerational opportunities. I'm saying that again, but that opportunity to really find a way for our youth to be able to engage with our older communities and helping them to see the value in that, but also the opportunities to allow some of our older community members to share the great wisdom and that they have to offer that often doesn't get celebrated. And I think that opportunity has certainly been something that we've really thrived and enjoyed. And I think it's a great thing to celebrate and try and find more opportunities for. I think an opportunity to identify support target I'll say that again. An opportunity to identify and support target groups is really important. So I think actually looking at what the local needs are First of all, identifying what are the target areas in your community and how can you actually support them. In ours, it tended to be straight away we saw that the youth was something that we needed to do because they were quite disengaged, and we had to look at opportunities that existed for them. But also our farmers started to be an area we needed to look at. Certainly being a demographic that is suicide risk is becoming an issue with, and it became an area we really wanted to look at. Now, as our time is growing, we're identifying new areas that we need to look at. I know some communities might be looking at Indigenous populations and might be looking at all sorts of different things. That's really localised to each area, but I think it's really important to think about that and consider it. And I think last but not least, actually thinking about how the work as a team can feed into Shire strategic planning, because this is not only important for the team because it means that you start to get credibility, but it's fantastic for the Shire because suddenly they're seeing that an active team is doing some work, and by working together you can actually get really great outcomes for both sides of the fence. So I think that's really important. So now I want to talk a little bit about some key areas for development when actually creating a community approach to mental health. Now, a starting point is very much collecting data so that you're actually working from a point of key areas as opposed to what you think might be the key areas. So I'm going to talk about that in a little moment, but I just want to talk about a few other things first. So when working as a community team, I think it's really important to consider what mental health awareness and education exists within your community and region. Is there good education and awareness, or do you need to start from a point of identifying that shared understanding of mental health? So that's a really good place to start. And thinking about what might not exist, what can you actually fill the gaps with? What can you actually put in place in terms of education in mental health areas? So I think the next thing to really consider is what current support pathways exist. What does it look like for someone in your region, in a city or your community when they need to go for help? And actually testing out that pathway and seeing if it leads to something that's going to be effective, or do we need to look at what's going on? And certainly looking at gaps in services. We identified recently as a group that transport was really an issue. A lot of people were wanting help but couldn't get to the help because it didn't actually exist within our town. So we needed to start thinking about, do we need to provide a way for people to get there, or perhaps we need to find a way to get people to our town so that people could access them. I think considering the opportunity for community events, and which in itself provides an opportunity to develop a sense of belonging in community, and really thinking about that old coming together of old, which really fosters that sense of belonging. I think considering what current communication and processes exist between the sectors and agencies. So is there communication that exists? Obviously, we need to consider the confidentiality aspects, but certainly thinking about how can we strengthen communication to make outcomes more effective. And as I mentioned before, considering the needs of various target groups and actually making plans for each of those target groups within your community to ensure the benefit for your community in that area. Now, I just want to talk a little bit now about some strategies for implementing a community approach to mental health. Now, I'm only going to talk about these briefly because we've only got a short period of time. But if you would like more information, please get in contact with me. I will talk a little bit more about how you can do that in a moment. But certainly, as you can see above, there's certainly ways that you can get in contact with me on my social streams. If you just put in Think Effective Consultancy or Renee Knapp, you'll be able to find me on those things. So really, I just want to talk a little bit about some key things that I think that are important when adopting a community approach to mental health. So first and foremost is having a clear plan for improvement. Now, by a clear plan, I firmly believe that having an implementation type ladder is really critical. Now, what I mean by that is a checklist or some form that actually gives you the entire overview of what you're going to try to achieve. Now, I can certainly share some of those things with you because I've developed them for my context, but I've found that to be really critical, certainly as the chair of the committee, because I know where we're heading and I can keep pushing us along to ensure that we're getting to where we need to be. I think having a motivated chair is really important. I think that chair role plays the role of, as I said, keeping that momentum going and keeping that drive happening and being the person that drives that change. Now, that's not to say that they're doing all the work. Instead, they're the person that keeps that team going and ensures that progress is being made. And I think that's really important. I think having a shared understanding of mental health is a great starting point so that you ensure that you're all on the same page. And maybe it's a matter of finding that shared understanding of mental health. I think having clear communication and meeting processes is critical. Often the people that come onto these committees are very busy people who tend to put their hands up for things. You're possibly one of those people if you're coming and sitting in on this meeting. So when you go to a meeting, you want to come away feeling you've achieved something. So really having good meeting processes are very important. And I've got lots of fantastic things that I can share with you if you're interested in working in that meeting type space. And absolutely inviting key people onto the team. Some important representatives that you'd probably want to consider. As I've mentioned, I think having education, health, in that very broad aspect of health. Law enforcement, I think it's fantastic if you can have a Shire representative on there, and certainly some community members. We started our team with only 4 to 6 people, but have just recently grown it considerably to about 15 to 20. But I don't think it matters if it's small to start with, as long as you have some important people on there. But one other thing I'd like to mention is that when you have the opportunity to, please engage someone as a dedicated grant writer, because it allows that person to really focus on just that one role. And it has been a game changer for us in terms of getting monetary support for our group. As I mentioned before, I think collection of baseline data is really important because it allows you to understand the true needs of your community on your region. We often assume we think what we know is going on, and quite often we're right, but it's really good to get a true indication from a wide catchment of our area. This allows us to then set some initial goals so that then we can have some early wins and get some great achievements straight up, which makes us feel good, but also lets the community see what outcomes we're doing in that area. And it also allows us, so by collecting data, it allows us to start seeing some gaps that might exist. And we actually created this next document, which we called our three-tier document. And we looked at tier 1, what was currently going on in our town in terms of awareness raising, what was going on in terms of prevention, what was going on in early intervention. And that then allowed us to set some clear goals around that. So as I mentioned, letting the community see what's going on and having some early wins is a great thing for both the group, but also for the community. I think it's really great to actually initially identify some local protective and risk factors. So we actually identified what are some things in our local community that are really great, that protect mental health and well-being for our residents, and what are some of the risk factors that exist that we can consider supporting and looking at. I think it's also really fantastic to create opportunities for relationship building. This is a great thing whenever you can do that, to absolutely use events as an opportunity to raise funds and to really work towards writing a community wellbeing plan, which, as I said, that's where we're at now. It takes time, but it's a really great goal to have. Now, I know that's been a lot of information. It's been a huge amount of information for you, and you're probably feeling like it's been a whirlwind. But I would absolutely love to chat to you either in the question and answer space, but also if you want to get in contact with me, there's a few ways how that you can do here. You can certainly visit my socials that I showed you on the previous page, but also you can visit my website. That's got lots and lots of information. And over on the side here, you'll see if you actually go to this other link, you can see some step-by-step instructions for specifically doing a cross-sector approach to mental health. I also have some other information on my website about mental health and behaviour stuff. You can certainly subscribe to my free newsletter, and I'd love to hear from you in either an email format or a phone call. Please, no question is too difficult to ask. I hope that I've provided you a little bit of a snapshot into why community approaches to mental health can be really beneficial. And I hope to hear from you, and hopefully I can answer some of your questions and help you get onto the road to achieving great success in your community. Thank you for joining me today, and I hope to chat to you soon.